The aim of the demo is to show how we can build an application to help alleviate the burden of cardiovascular disease on the NHS. Cardiovascular disease is one of the largest costs to the NHS by disease state. There's an estimated cost of around £10 billion per year to the NHS due to cardiovascular disease. The majority of screening for CVD is typically done within a primary care setting. Patients receive a risk assessment, and then based on the outcome of that risk assessment, patients receive further diagnostic tests. And then based on the diagnosis, patients receive either preventative measures or treatment. However, those risk assessments are often incorrect, and those incorrect risk assessments can lead to either the undertreatment of patients and worsening patient outcomes, or they can lead to the over-allocation of costly diagnostic tests, which increases the incurred cost of the NHS and the use of valuable and scarce clinical time. So the aim of the application is to see if we can increase the accuracy and early detection of disease, and we do this by predicting the LDL cholesterol for individual patients, which is a major indicator of cardiovascular disease, and this prediction will help when practitioners are undertaking risk assessments to make better, more informed decisions on their resource allocation. In this case, the resource being those costly diagnostic tests. So we do this by first importing our patient data. In this case, we can think of each of these IDs as an independent patient, and for each patient we have a number of physiological and lifestyle features. We can use these features such as diastolic blood pressure, systolic blood pressure, gender and BMI to train a regression model and to make predictions for LDL cholesterol for each patient individually. We can then, through the workshop application, we can embed this prediction model, which will then, for each of our patients, give us an updated LDL prediction based on their underlying features. But we can also update a number of these primary features such as body mass index, and we can see the subsequent change in LDL prediction. And this LDL prediction will help practitioners make more informed judgments when they're assigning diagnostic tests. So in this case, if we wanted to assign a diagnostic test, we can assign a specific test to a patient, and we see that mirrored within our workshop application. And this is also mirrored within the ontology object which we created under blood test assigned column. Now, if we wanted to really close the loop on this application, we could schedule the running of that predictive model which we've generated for each primary care client's data. And based on that predictive model's outcomes, we can then automate the booking of diagnostic appointments for at-risk patients. So we wouldn't even need to provide this to practitioners themselves, but we could also just automate this process entirely. But if we wanted to give it to practitioners, or if we wanted to maintain the platform for practitioners as well, we could have some association of the assigned blood tests and what that means in terms of incurred costs for the practice. And we could lead to some sort of price capping to prevent the oversubscription of blood tests by specific practitioners.